Hello everyone and welcome to Pediatric Talks with Dr. Kazmi. My name is Dr. Saeed Kazmi and in today's episode we will dive into a crucial topic in pediatric health, and that is complex urinary tract infections, or simply called UTIs. Now, UTIs are a common childhood infection, but when they turn complex, they require special attention. So let's unpack what makes UTI complex, why they matter, and how they are best managed. So let's start by defining complex UTIs. So first, let's define what we mean by complex UTIs. Now, unlike simple UTIs, which are typically straightforward urinary tract infections, simple to treat, the complex UTIs might involve unusual pathogens. They might involve unusual host factors like underlying health issues or an unusual course of illness. In other words, it means that the child has either an anatomical anomaly or a urinary system for abnormality like a single kidney, maybe a horseshoe kidney, a low implanted ureter, double ureter, or maybe polycystic kidneys, etc. etc. Or the child might have pathological abnormalities associated with urinary system. For example, having renal tubular acidosis, having vesicoureteral reflux, or immunosuppression. Now, this also includes recurrent infections or infections caused by antibiotic resistant bacteria. So, let's focus on causes and risk factors. Now, understanding the causes and risk factors is very important. Factors like anatomical anomalies in the urinary tract, genetic predisposition, and environmental influences like the hygiene practices, they play a very significant role. Now, some of the common anatomical issues which can cause complex UTIs are like vesicoureteral reflux, where the urine flows backward from the bladder towards the kidneys, dramatically increasing the risk of complex UTIs. Now, this usually happens when the angle between the ureteral implantation in bladder is not acute and is shallow, leading to more chances of retrograde flow of urine. Posterior urethral valves are an anatomical anomaly at the neck of bladder which can cause obstruction to urinary outflow when the child strains to urinate and can lead to backward flow, causing increased chances of UTIs. Then, other anatomical defects like double ureters, single kidneys, or sometimes cystic kidneys can cause urinary retention and can increase the chances of bacterial growth in that retained urine. Constipation can also increase chances of repeated UTIs by putting physical pressure on the bladder and increasing the chances of backward flow as well as urinary retention causing UTIs. Now, what makes them complex are these structural and pathological processes which can make it hard to treat and hence requiring special measures sometimes. Now, let's focus on the clinical presentation and diagnosis. In terms of symptoms, complex UTIs in children may present differently based on the child's age. While older children can express symptoms like pain during urination, young ones might show non-specific signs such as irritability or high-grade fever and sometimes vomiting as well. Now, moreover, the illness itself can be anywhere from a mild one on one hand to almost a septic picture on the other hand. Now, this makes early and accurate diagnosis very challenging, but yet essential to prevent serious complications like kidney damage. Now, diagnosis usually starts with the urinalysis and urine culture. Now, for that, collecting a proper sample is very critical, especially in young children. So, a clean catch is necessary, but it sometimes can be quite challenging in young children and it may require a suprapubic aspiration in certain cases. Now, if a UTI is confirmed, especially if it is a second infection or is accompanied by fever, then further diagnostic workup is necessary. This brings us to advanced diagnostic imaging. Now, in advanced diagnostic imaging, a renal and bladder ultrasound is often the first step. It's a non-invasive and a safe procedure, and it provides a preliminary look at the child's anatomy of the renal tract. However, in cases of recurrent urinary tract infections or if the abnormal ultrasound is abnormal or shows abnormal finding, then more detailed imaging is needed. Now, ultrasound is usually done within 6 months in children less than 6 months of age, and is done immediately if there are atypical infections between 6 months and 3 years of age. Now, ultrasound helps to visualize the size and morphology of the renal tract. It helps in detecting presence of any scarring, presence of any calculi, hydronephrosis, etc. Another diagnostic technique used is voiding cystourethropy, or also called VCUG. Now, this test is vital for detecting what we call as vesico-ureteral reflux. Now, this test involves a catheter, a contrast material, and X-rays, and is done in children aged 6 months and less if they have got atypical or recurrent UTI only, and is usually done within 4-6 months after the infection. Another important study is what we call as a DMSA renal scan. Now, it is more sensitive than ultrasound for detecting renal scarring. And renal scarring, as you know, is a serious complication of repeated UTIs. So what happens, a radioactive dye is injected into the child's body, and after some times gamma camera images are taken to check for the uptake of this radioactive tracers. Now, scarring usually appears as cortical defects, as you can see right here in this diagram. Again, it is done in case of atypical or recurrent infections irrespective of the age. Another scan is DTP or MAG3 scans. They are done to visualize the excretory outflow tract and is done only if you suspect an obstructive lesion. And now coming to the management strategies. Now, managing complex UTIs involves what we call as a multifaceted approach. Now, initially, appropriate antibiotic therapy based on culture results is vital. However, simply treating the infection isn't enough. Addressing underlying causes like anatomical abnormalities may require surgical interventions or long-term management strategies like giving them prophylactic antibiotics. Empirical antibiotics like cefalexin, nitrofurantoin, trimethoprim, they can be used orally in mild cases, and drugs like ceftriaxone, amikacin, or quinolones can be used in severe cases. Now, in majority of the cases, low-dose antibiotic prophylaxis is necessary to prevent recurrency. Now, a regular follow-up at the GP to check regular blood pressure and renal functions are also important to detect and prevent any chance of chronic kidney disease. At the same time, it's important to have a multidisciplinary approach to address any anatomical defects, like, for example, reimplantation of the ureter, maybe resection or ablation of the posterior urethral walls, or ureteric stenting. It might be necessary based on whatever the underlying problem is. Now, equally important is the role of patient education and preventive measures. Now, parents and caregivers, they play a crucial role in recognizing early signs of UTI and maintaining good urinary hygiene in children. So, to wrap up, complex urinary tract infections in children are more than just a simple nuisance. They require careful, comprehensive management to prevent serious long-term consequences. Early recognition, accurate diagnosis, and a tailored approach to treatment and prevention are key to ensuring the best outcomes for our young patients. So thank you for joining me on my channel today. I hope this episode has shed some light on the complexities of UTIs in children and the importance of diligent care in these cases. So stay tuned for more insightful discussions on pediatric health. Would be coming up with some new videos soon. This is Dr. Said Kazmi signing off. Bye bye.